Good afternoon, dear patients. Today we will discuss a case presented in the picture. This is a case of erosion on the glans penis. A young man came to see me who had redness, and inside those areas there was erosion. What is erosion? It is a disruption of the superficial layer of the epithelium, the very top layer of the skin, and the glans is also skin. So a disruption of the integrity of the top layer of the glans is what we call erosion. Ulcers are deeper. Erosion is a superficial lesion. So why did this patient develop erosion? Well, basically, it's his own fault. In fact, almost all diseases happen because of us, and sometimes because of certain doctors as well. What happened? This patient had redness of the glans and a coating on the glans. Tests were taken, which he provided to me. He had a PCR 15 test done, and Candida was detected. Candida was found, and the doctor began treatment. It's unfortunate that the doctor didn't take a culture for Candida. Now, unfortunately, even if Candida is detected, its sensitivity is often highly distorted. Naturally, doctors usually have only one medication for Candida and nothing else. That is the oral medication Fluconazole and the topical cream Clotrimazole. These are the favorite medications of all dermatologists and patients because they are very cheap, and patients think that getting rid of Candida is very simple. And because it's the only medication they actually know. Recently, a patient came to me whose doctor at the dermatology clinic gives out a sheet with only 7 medications and checks off which of these drugs are needed for a particular patient. In other words, he doesn't know more than 7 medications at all for skin and venereal diseases. Excellent result. So, accordingly, this patient was first prescribed clotrimazole ointment and oral ketoconazole, which is already surprising. The doctor knows at least 2 medications. Then everything went back to fluconazole. And after 5 days of clotrimazole, hormonal drugs were prescribed, such as Triderm and Pimafucort. These are medications that, along with clotrimazole, also contain a hormone. A topical hormone in the form of a cream. What happens if you apply such creams? It's akin to wrapping the head of the penis in plastic wrap. Wrapped in plastic wrap, as a result of which, firstly, normal evaporation of moisture from the surface of the glans becomes impossible. It's like the glans is trapped in plastic wrap. That's the first point. Secondly, the already thin layer of epidermis on the glans becomes even thinner under the influence of the hormone. This effect of the hormone is generally described in the literature. As a result of these 2 effects, erosion develops. Moreover, the patient was persistent and applied these hormonal ointments for about 3.5 to 4 weeks. As a result, the redness began to increase and take on a somewhat different character. But he kept applying and applying over and over again. And as a result, even erosion appeared on the surface of this redness. Accordingly, the erosion is no longer from candidiasis and redness, but from hormones, hormonal creams, and ointments. In other areas of the skin, even scars can form, while on the glans, such erosions develop. Moreover, they very often merge together. This is actually the mildest scenario. And as they take on the form of large confluent erosions, we will definitely take a separate photo when we have such a patient, specifically for this issue as well. So, accordingly, what needs to be done? The most important thing here is accordingly to discontinue the use of hormonal ointments. And then prescribe disinfectant medications, and all of this will gradually heal. For example, sitz baths with the same Furacilin and carefully monitoring with antihistamine medications. You can also prescribe a healing agent like Methyluracil, which was done for this patient. But the most important thing, of course, is to discontinue hormonal ointments. What would I like to say in conclusion? In conclusion, I would like to say that you shouldn't overdo it with ointments. Again, instead of actual treatment, we are faced simply with the prescription of some topical medications, specifically ointments. I understand that patients are not aware that ointments alone almost never provide a cure. Of course, you need to understand that if you go to a dermatological dispensary, which is often limited in terms of free tests, then most likely this is what they will try to do. If the ointment helps within 5 to 7 days, that's good. If you see that the ointment is not working on the glans penis or is causing symptoms to worsen, change your doctor or return to the same doctor if you trust them. You shouldn't persist and keep applying the ointment against the background of worsening symptoms.